Hi, welcome to my video titled Solitary Confinement. I'm Carl Torsbins, former and retired Deputy Warden, Arizona, New Mexico Department of Corrections, and I served from 1985 to 2010. Started off as a correction officer and retired as a Deputy Warden of Operations, and I truly want to apologize for not being able to be there in person for the conference, but I had a conflicting court agenda that didn't allow me or wouldn't allow me to be there due to case preparation cases. As we already know, the world is being overwhelmed by the media and other advocacy resources with an outcry of criticism of prison management styles, often referred to as solitary confinement. One could research the model on the web and learn about its impacts and characteristics, but in reality, they couldn't begin to understand the conceptual thinking behind the various models used around the world, our country, in jails and in prisons. I can suggest reading the ACLU PowerPoint dated March 2013 about solitary confinement, but it barely touches on the realistic and political edges of the phenomenon men, women, and even children have to endure while under such siege of the human spirit and soul managed through mass incarceration agendas nationwide. It does little for the actual destruction of human life behind bars and inside these lockdown units spread throughout the United States. The outline does not discuss or cover such topics as bigotry, personal biases, environmental injustices. In other words, there are mentally ill that are devaluated, left for dead. Others, with strong body and strong minds, are pushed up the food chain so they can be used to benefit the internal political systems within our prisons. They are skilled and they are more valued. They are unskilled or mentally impaired, they become devalued. Furthermore, it doesn't reflect the true deliberate inferences targeted in four main areas, creating it in the environmental justice factors: demographic influence, geographical equity, procedural equity, and social equity. These are dynamic and they're ongoing, and focus must be made on these elements to carry out its purpose for decision making. Slippery slopes, to say the least. The agency's been successful because it divides and conquer in a policy that keeps the races apart. It would be hard or difficult to understand what solitary confinement does to a human being unless that human being is willing to be used as a guinea pig and voluntarily put themselves in a concrete box surrounded with steel, no windows, and no control of utility, light or darkness, time or sound, water or toilet, or stainless toilet symbol combo that sits at the edge of the cell, designed to be the farthest away from the bunk so they don't have to smell their urine or their feces. This personal sacrifice to experience living while buried underground would take a toll of even the strongest men, as the environment is cruel, harsh, and toxic to endure even over a short period of time. Given just enough room to move in and allowed only a portion of the personal property allowed by general population inmates must adjust to various factors that impact their well-being and their sanity, imposed for isolation and control. The psychological and physiological impact are extreme, to say the least, and are often the core reasons why the mentally ill are so unstable and unable to cope and function in such an environment. Unfortunately, that doesn't prevent their placement in such units. Working inside there and supervising staff as well as serving as an administrator gives me an opportunity to see this design destroy the human mind and body 24 hours, 7 days a week. I've seen strong men falter and weak men broken to the point they had to be carried out on a gurney due to weakness and ailments, diseases that were inflicted by both nature of the environment and their own wrathful design of the M.I.S.S. Eventually they lose control with reality, begin to self-harm, cut, bang, twist, overdose, hang themselves, unbelievable manners described as appalling and punishing in manner. Self-destruct is common in solitary confinement. Strong men and women falter less or within longer periods of time. Some are stronger, some are weaker. It depends. It also depends on how much they suffer. The system is designed for rehabilitation and return of civility and responsible conduct, but when you put in solitary confinement, it falls short to attain just the opposite side of this goal. These bizarre occurrences and damaging kind of attacks come from different directions. Indiscriminate housing placements inside maximum custody units and placed there for reasons that may be justified on paper but often exaggerated to warrant such a long-term solitary placement. Wrongful targeting of individuals identified as high risk or high problematic, therefore cast into these cells for the expediency of not dealing with them on a daily basis, and direct result of physical plant where there's no direct sunlight or fresh air. Some are created by staff that work there and torment them harshly without justification or provocation. Some are there because of policies and procedures imported and often altered through tacit approval or modified directive harmful to the human spirit and dignity. That turns short-term placements into long-term placements, depending on the politics in the placement reviews and timeframes that are unreasonable when it comes to institutional classification changes or recommendations. Much of the structure within these isolation and control units have been fallen victim to the mission creep and is in dire need of reorganizing and restructuring primary and secondary auxiliary support services that include medical, mental health, educational, and rehabilitative in-cell programs to reactivate the human mind and restate their function in social skills, problem solving, individual responsibility areas, anger management, and interpersonal skills so that when they're released into society, they are prepared to mingle. It's time for society to examine these harmful conditions inside the courtroom or legislative meeting rooms under a forum that nurtures the restoration of basic human rights and the return of human dignity and respect that has been degraded and devalued over the past decades. Solitary confinement tears a man down. Solitary confinement tears a spirit of the human being and exposes them to the four influences in hell. We've talked about the continuum of biases, a summary of the conditions, a journey of infinity, and a release without preparation. Simply put, solitary confinement is counterproductive to keeping men and women and children locked up in conditions that even the strongest cannot survive. You have to understand that what is happening in this continuum of biases is discretionary decision making that is not right. It is based on subjective material. It is based on personal viewpoints of how people should be doing their time inside prisons. It has nothing to do with sound correctional practices. It has to do with the way that they themselves personally perceive the way things ought to be according to their belief how people in prison should be treated. I call it the continuum of deliberate indifference. When you look at this, you look at there's two choices there, compliance and non-compliance. But remember, a person can be put in solitary confinement even when they comply all the time. You know, it has to do with unethical employees, poor training, poor supervision, a bad administration, being in a bad mood or having bad temperament to do that kind of work, and attitudes. You could catch a person on the wrong day and end up being on the side that puts you into solitary confinement. Potential targets are weak and strong individual personalities, bullies, sexual harassment personalities, homosexual or gay behaviors. So many different influences that puts them in hell that you have to try to understand that the criteria has become too subjective to warrant their prolonged placement in such a restrictive environment. This does not do anything in the order of restoring their rehabilitative abilities to come back to our society. This does nothing. Look at the negative impact of solitary confinement: hypersensitivity to external stimuli, perceptual disorders, hallucinations, increased anxiety and nervousness, revenge fantasies, rage, irrational anger, fears of persecution. I mean, can you imagine? These are just the beginning of a long list of negative impacts of being locked up like that. How you would react if you were exposed to these kind of conditions? You lose your impulse control. You create claustrophobia. You have severe and chronic depression or isolation. You have an appetite loss and a weight loss. You have heart palpitations. I mean, physically and psychologically and physiologically, Solitary confinement tears a man down. You suffer from withdrawal, the blunting of affect and apathy. You don't care anymore. You start talking to yourself. You have headaches. You have problems sleeping. Understand that in solitary confinement, you can't control the environment. They control you. If you want to sleep during the night, you have to put up with the noises of around you. You have to put up with the lights that stay on so staff can watch you. It is an unreasonable condition under unreasonable circumstances. You have confusing thought processes. You become so confused that you do things that you would never do any other time in your life. You have nightmares. You have periods of dizziness, and you start thinking about self-mutilation and harming self. And you have a lower level of brain function. I mean, think about it. If you don't have anything to do, what does your mind tell you to do? You can try to be creative, but you're doing your time under the most harsh conditions that man has designed when you are incarcerated. And whether you're in California, or whether you're in New York, or whether you're in Texas or Colorado, solitary confinement is present in every one of those states. And remember what I said, it's not a condition that is easily explainable without having to experience it first. Remember that solitary confinement can be a journey that lasts forever. Remember that there are legitimate reasons for putting people in isolation, but those reasons need to be logically and objectively reviewed as time goes by, so there's an opportunity for them to be released once their behavior complies with the policies and procedures that they're expected to follow. The conditions are harsh, the conditions are toxic, and I want you to understand that I'm not a hug-a-thug type of individual, but solitary confinement does little to make a person better. It is designed for isolation and control. It is designed to keep someone from functioning to their fullest ability, and it's designed so that the mind breaks the body down and the body breaks the mind down, creating a total breakdown of the humanity that was once within you. I thank the ACLU for providing the PowerPoint.